Hey, welcome back. So, I want to talk about things you should be aware of when you're admitting someone to a nursing home. Things that you need to be doing or be aware of as you're admitting them. Three things. I'll try to remember them: optimal admission timing, preferences, and the DNR or do not resuscitate form. Those are the three things I want to talk about. I want to remember them. So, let's talk about optimal admission timing first off. So, your loved one, when they first get in a facility, is going to be assessed by the charge nurse on a whole number of factors. And it's going to be a little time consuming for her to do this and do it right. You want to make sure you catch her at the beginning of the day, because if it's midday or later in the day, she's going to have to rush and get it done, and it's going to be sloppy. And it really is important that this admission assessment go right from the start. And you're kind of going to want to tell her some stuff too, and not feel rushed doing it, you know? So if your loved one's at the hospital, tell them up front, I want to leave early morning. These charge nurses generally, they either start their day at 6 in the morning or 7 in the morning. So ideally, you want to try to get out of that hospital soon after that. So try to tell them that up front so they know what they need to do, and just pressure them as much as you can. I'm not a hospital expert, but that's what I would try to force them to do. And if they're coming from home, well, hell, that's easy. Just leave home early in the morning, bring all the things you have to admit them. Well, that's just going to make it smoother. And before you go in there on their admission to that with that charge nurse, I want you to also let her know. And hopefully you met with a social worker or the admission coordinator. You told her too, but talk to your family and loved ones and people who know your loved one, and try to tell them about all their preferences in terms of whatever it might be, but especially in regarding to like food and drink. That's really an important one. What their eating habits are, and are they big breakfast eaters? Are they big lunch eaters? Do they like certain drinks or snacks? Were they snackers more than they are big eaters? All those things are good to know. And, you might have to bring that up again to them later if they ever have weight issues. But it's good for them just to know that, especially that charge nurse right off the bat. So hopefully they will incorporate some of those preferences into their plan of care, And like I said, it's not just dietary. It could be other things that are maybe peculiar about when they like to go to bed or take their bath or any of those things. Try to get those things just clarified up front so you're not having to try to fight them later, getting schedules changed around, all right? The third thing is, when you admit a loved one in a nursing home, they will produce a DNR, which is a do not resuscitate form. That's basically saying, if you sign it, you basically say, yeah, if they are found without a pulse and without respiration, that they will not proceed with CPR, cardiopulmonary resuscitation. In other words, they won't try to revive them. And that may seem a little controversial and a little cruel, but it really depends on the situation of your loved one. If there's somebody that is younger and expected to return home, okay, yeah, don't sign it and just say, yeah, I want full code. Full code means they're going to do the CPR. That's the term they use. But for a lot of people, when they're frail and elderly, if you do the CPR, a lot of times it can result in serious injury like broken ribs. And we're talking there may be a period of time where there was no oxygen in the brain. So when they do come back, they're not able to think or communicate the way they were before. They're different. And some people too, it's like, depending on the situation, you don't want to extend death for somebody. For a lot of people, it's just, they don't have a pulse, they don't have respiration. That's because it's part of the natural dying process. And if you interfere with that, you just make it more traumatic for the person, So you have as a family, or the person themselves has to make that decision A lot of times if there's like a living will, that decision is probably indicated on there. But if if their situation has changed, they may want to be a do not resuscitate person, you know? So that's a personal family decision that has to be made, but generally that's why that's an option, because they've gotten away from making it very much like it used to be, I guess, in the 70s, where they treated death like a disease itself, and you were just in the hospital, and that was before we had hospice services and things like that. So if you like the video, please give me a like, share it with people that might need it, and I will look forward to seeing you at the next one.